Kids really do grow up fast, and they need essential vitamins and minerals for their growing bones and muscles. Now, the vitamin status of a child depends on many factors, and there can be major differences in access to adequate nutrition for children coming from different countries and regions. However, a closer look at resource-rich societies with ample access to any type of food reveals that it may still be difficult for some to reach an adequate vitamin intake, especially for the vitamins D, K, and B12. So today we have Dr. Paulo in studio to discuss the role of vitamin supplements in children. Paulo, for the purpose of this discussion, what are we calling children? What sort of age group are we looking at?
All right, so in the biological sciences, a child is from birth until puberty.
Okay. So Paulo, I mean, as my intro mentioned, I mean, even in resource-rich countries, people are not getting sufficient nutrients or nutrition. I mean, what are the considerations, let's call it that a parent might be looking at as to whether they should be including supplementation in their child's diet?
Well, in cases of malabsorption syndromes, for example, or other inborn gut structural problems that a child is born with. Of course, supplementation is required, like celiac disease, for example, but I don't think that's what we're discussing here. We're talking about children that have no structural problems, no diseases at birth that would affect the absorption of nutrients.
Right.
So when does a parent decide to supplement? Supplementation should be used on the back of a nutritionally sound diet to ward off potential vitamin deficiencies.
Okay.
The challenge currently is that most foods are nutritionally bankrupt, especially processed foods. There are now even ultra-processed foods, whatever that may be. Okay.
Just stay away.
Yeah. So those foods are nutritionally bankrupt. So it's not the quantity of food that seems to be the challenge here, it's the nutritional content of foods. So when a child eats nutritionally bankrupt foods or nutritionally deficient foods, those foods have to be processed.
Yes.
The processing of those foods will burn through nutrients, vitamins and other nutrients that are already in the body that would be required for growth and development of the body itself.
Okay.
So not only are these foods not bringing in more nutrition, they are consuming some of the nutrition that was already there.
Right.
So that's very, very important to remember. There are obviously special considerations. So children that are vegan or vegetarian because their parents intend them to be so, they'll be at greater risk of specific vitamin deficiencies. Of course, children that are recovering from disease, and then children that have increased demands, those that do sport or exercise, picky eaters, they call them, for example. You know, the child that he doesn't like anything that's green on his plate, and for some odd reason he's allowed to rule the table. Okay, but that's obviously another conversation.
Yeah.
So it's difficult to say. I would say that you mentioned that in Western rich societies which are developed and where we believe there is an adequate access to food, yet there are deficiencies in specific vitamins, and we'll probably note that most of these vitamins are not produced by the body, and if they are produced in the body, they're produced in low amounts, or they are required. So the demands for specific vitamins during the growth process are different.
Right, okay.
So that's another consideration.
Paulo, I mean, is there a risk that parents might surrender their responsibility for providing a good nutritious diet to their children by saying, that's fine, you know, we can eat rubbish and we'll just supplement?
Well, I hope not. I hope not, because then we'd have to speak to those parents. I think that obviously we all know that we are fashioned in terms of what we eat depending on where we grow up. So your parents' eating style is what you are subjected to, at least, until you are older and you can decide to change things. So that will obviously play a role. Okay. So if a parent's style of eating is not a healthy one, all right, and if he then considers that's because the child is developing, then we should give him a supplement, because we know that we don't eat healthy, but you know, we don't have time to prepare healthy food, and I really don't like green food in any case, so it's never at home. There's no green food at home, so let's just compensate. So that compensation mechanism is better than nothing.
True.
Okay, but the background against which it happens is not appropriate.
Yeah.
Okay, so I would hope that in today's world, we are hit from everywhere as to what is healthy and what is not healthy. And it is obviously up to the parents to set examples. And I think this is where the problem begins.
So Paulo, I mean, we know that there are certain vitamins that are really essential to be getting good quality and quantity of, those being specifically B12, vitamin D and vitamin K. So maybe let's start with vitamin D. I mean, would supplementation be necessary in children with vitamin D as standard, or is it exceptional circumstances?
Yeah, as a medical practitioner, I'd say yes, most definitely. So vitamin D is crucial during the growth process for bones, obviously, for brain function. It's also crucial for pulmonary function. And we know that upper respiratory tract infections are a huge problem with young children. Okay, they're also shown to ward off diseases such as multiple sclerosis, autoimmune conditions as well. Okay, so it is very, very important to have adequate levels of vitamin D. Now, vitamin D is hardly obtainable from foods, so it is produced by the action of sun's rays on your skin. It is only the B ultraviolet rays that have such an effect. The B ultraviolet rays need to be at a specific angle, and that only happens during a specific time of the day. So you could be in the sun burning literally from 3 to 5 in the afternoon, but there are no B ultraviolet rays at the correct angle.
Okay.
So it is very, very important. In my experience with adult patients, I have never had an adult patient that when we tested vitamin D3 levels had adequate levels.
Absolutely. I mean, if you think about it, we spend so much of our time inside, sitting down behind a computer at a desk or something like that, or with kids playing games on the computer or the TV. So the potential for that time is vastly reduced from what it used to be.
Yeah, so vitamin D3, the supplementation would be crucial.
And vitamin B12, I mean, that's also something that we frequently talk about as being highly essential. What are the conditions there that kids are dealing with?
So vitamin B12 is essential in terms of growth because it's essential for the production of DNA, the production of hemoglobin for the blood, which then carries the oxygen in the blood. It is also crucial for the development of the brain. So in terms of B12, the one challenge affecting children is that if the mothers are vegan or vegetarian and they went through pregnancy with a B12 deficiency, which is common to vegans and vegetarians unless they do something about it in terms of supplementation, then that child is at a terrible disadvantage.
Okay.
It has been shown that these children are more prone to the development of anorexia, for example, hyperpigmentation. They have growth retardation, so in other words, they don't develop as well as they should have developed. So B12 is a crucial vitamin. Another very important thing to remember is that even if your diet comprises foods that contain B12, absorption of B12 is difficult by nature.
Okay.
You probably only absorb 1% of the B12 in the food that you've just eaten. Therefore, in children specifically, B12 is definitely a necessity.
Okay. And the third one that we mentioned earlier is vitamin K. Now, there's more than one type of vitamin K, so maybe just clarify what we need.
So there's vitamin K1, which is obtainable from plant material. Okay, so from fruit and vegetables, the function of which is mostly to do with the coagulation system of the blood. And it is easily absorbed, it's processed by the liver. Usually those levels are not a problem at all.
Okay.
Then there's vitamin K2. So K2 is produced by the bacteria in the gut. It can be obtained in certain animal products or in eating fermented foods, which are not popular in most cultures. All right. So, and K2 is very important because the body can convert K1 to K2, but this conversion is not really efficient to cater for the needs. K2 is very important in terms of bone development, skeletal development. It's very important to make sure that the walls of the arteries don't have more calcium than what they should have, because if they do, then that calcium solidifies in a sense. It's almost as if the body is making bone within arteries. Now that process usually comes to the fore much later in life, but it has its roots earlier.
Okay.
In other words, many of these processes or detrimental processes in the body are very, very slow. You can take 40 years to rear its ugly head.
Yeah.
So vitamin K2 is very, very important in terms of children's development.
So Paulo, it's all good and well to talk about supplementation for children, but it's not always easy to get them to take a couple of pills in the morning with their breakfast. So we found Phytoceutic's Phytomist range of products, which basically covers all of the ones that we've been talking today. I mean, how much more appropriate is it, like a vitamin spray versus trying to get a kid to take a pill?
Well, it's obviously easier. So there's no water, no fuss, no pills to swallow, no running around to try to catch a child before he takes the pill. So these sprays usually have natural fruit flavors to begin with. So in terms of taste, there's no issue. And they are absorbed. So they are little micro particles in the spray that are absorbed through the inside lining of your mouth into the rich vein network below. So it's absorbed right through the blood. So obviously another advantage of sprays, generally speaking, is that it bypasses the digestive system. And it gets straight into the body.
And Paulo, I mean, is this something, would we, if we start supplementing these vitamins, would we be doing them for a long period of time or consistently, or what would be a sort of a useful arrangement, if we can call it that?
I would say that in terms of maintenance, or in terms of ensuring that what you consider as a parent to be an already nutritious and healthy diet, okay, doesn't have any gaps in it, so to speak. Okay, one can do a maintenance course of this kind of spray vitamins. It is not harmful with any of these if you were to take a maintenance dose every single day.
Okay.
It would not harm anybody.
Perfect. And Paulo, where can we find these vitamin sprays?
I believe they're available in health shops and pharmacies.
Wonderful. As always, some great insights, and especially focusing in on the kids today, which is quite important.